This occasion is a very important one for our patients and patients in this area. The main idea is to provide information about their own healthcare and how they can look after themselves through accessing the facilities available in this area, both private as well as NHS. Mostly we concentrate on the NHS provision because it is widely available, and it is with the support of our patient group as well as our PCT.
And there's a lot of presenters today as well. It must be quite nice to get everyone on board and everyone provide information to your I don't know, your friends, I would say, by the looks of it in there.
They are friends as a professional, not personal friends, but as a profession I work with everybody. PCT, my own colleagues in this area, GP colleagues, as well as managers with the patients, not only our patients but patients from other surgeries as well. So I used to have organize patient educational seminars which are empowering patients to look after their own health. Probably it's about once in 3 months. We have a subgroup, diabetes subgroup, mental health subgroup, weight management subgroup. They are all interested in looking after their own health, and this promotes self-care, and also the word spreads nicely, and it makes our life and their life more comfortable, and we live as a family, not as doctor-patient related. I mean, they are all my friends.
Yes, today we have lots of speakers here to encourage us to manage our diabetes properly. We need as much encouragement as we can get, particularly with not eating sugary foods. That's the main drawback of having diabetes, I think.
Because there was a lot also, because I was just in the presentations and there was so much information to take in. It must be quite tricky to just keep track of it all.
Yes, it is. That's why the meetings, the doctors' meetings are very important, because he holds them about once every month, and by the end of the month, with all the good intentions in the world, we do get lax and we do eat a few things that we shouldn't, and then we go to a meeting and it keeps us on track.
It must be nice as well being surrounded by other people all sort of in the same boat.
Yes, we've made quite a few friends. That's good, and we talk to each other and we exchange recipes and ideas, and we get lots of useful information on that level.
So it must be so supportive as well with like the design of the new sort of system, and being around people that you like and you're sort of friends with. It must be very supportive.
Yes, it is very supportive, yes.
And would you recommend it to other people? Would you encourage people to come on board?
Yes. Yes, my two daughters, I'm always encouraging those. They don't attend meetings, but I'm afraid they do have to listen to what I've listened to during the meeting, and that helps them to understand diabetes, just in case they get it in the future. They are trying to avoid it, and by me going to the meetings, they're able to do that.
Because also there's a lot of leaflets as well, so you can probably take them away and give them back at home.
Oh, unfortunately, yeah, there are a lot of leaflets, too many. I tend to get a bag full, and I'll get home and I think, oh, I'll sit down with a cup of tea and I'll have a look through, and they end up in recycling, I'm afraid. So that's where meetings are good again.
And overall, you're very happy with the system?
Yes, very happy indeed, yes. I didn't know anything about diabetes. I thought I did, but I didn't. So yes, that is very reassuring.
And you would recommend these meetings?
Yes, I definitely recommend the meetings. I think they're essential to a diabetic, very essential.